Hello everyone. So in the last video we treated what did we treat? We treated tension type headaches, and basically they are the common headaches that you get from stress, you get from being overworked, everything. So today we're going to look at another type, or another kind of headache that is also occurs it's also common, that usually occurs with a lot of people. So we're going to be talking about cluster headaches. So cluster headaches, they are basically a very severe one-sided kind of headache, and they usually occur in clusters or cycles, like the name implies. So they usually occur at the same time every single day for weeks or for months. So they have this peculiar time that they occur. Like if it's in the morning, if they should start in the morning, that means the next day, that particular time in the morning, you will have this repetitive cycle of headache. So that is how it occurs. So it is sometimes called the suicide headache because of how excruciatingly painful it is, and it is rare. It is actually rare compared to migraines or tension type headaches, but it is much more intense. So cluster headaches are not as common as tension type headaches or migraine. So cluster headaches, they are more common in men compared to women, and they tend to start between ages 20 to 50. So that is when the cluster headaches are more likely to start, and they come in clusters. That is like repeated attacks for weeks, months, and they are usually followed by a pain-free period known as remission. So they can be episodic, that is, they can be more common, and they can be chronic, whereby a patient has no remission, like no free period for a year or more. So that's why they are termed like very severe kind of headaches. So to understand cluster headaches, you need to consider, number one, the trigeminal nerve. That is the main pathway in the face and the head. Then the hypothalamus, that is the brain region that controls sleep wake cycles and biological rhythms, and it seems to malfunction in cluster headaches, especially it seems to malfunction in cluster headaches, explaining why attacks come at the same time daily or seasonally. So the autonomic nervous system controls involuntary functions like tearing, nasal discharge, and pupil constriction. So they are all affected in cluster headaches. So looking at the pathophysiology of cluster headaches, like what exactly is going on inside the body when someone has cluster headache. So there's usually like, number one, there's usually like an abnormal activity in the hypothalamus that triggers the trigeminal nerve. So this will now cause like severe pain around one eye, and at the same time the autonomic symptoms appear, like a patient will have like red eye, like will be tearing, will have blocked nose, or they'll be sweating too. So it's usually affects one side. So it's is one-sided, so it's strictly unilateral, so it affects one side of the face. So there's usually no structural damage, but the pain centers are usually hyperactive. So what exactly causes cluster headache? So the exact cause is not really known, but possible factors that can cause cluster headaches. So it could be due to hypothalamic dysfunction, it could be due to genetics, like having a family history, which is rare but is possible. Then also smoking. Smoking is very common among people that suffer this cluster headache. So smoking is a very main trigger for this kind of headache. Then alcohol. Alcohol can trigger attacks during a cluster period. Then strong smells, like smell of perfume, smell of petrol. So if you are exposed to this kind of smell like daily, so it can trigger this kind of headache. And also heat can trigger it. Stress and living in like high altitude too can trigger cluster headaches. So looking at the signs and symptoms of cluster headaches, so when it comes to the pain, like the kind of pain that comes with cluster headaches is sudden, is severe, is piercing, is like a stabbing pain. Then the location, looking at the location, it can be around or behind one eye or temple, and like I said, it's one-sided. So it's one-sided, like it doesn't switch sides during a cluster, so it's all the pain and everything will usually be on one side. Then the duration, it can be from 15 minutes to 3 hours. And looking at the frequency, it can occur like 1 to 8 times per day during a cluster or a cycle. So other symptoms, like there'll be red eye, there'll be tearing, there'll be blocked nose, sweating, droopy eyelid, meiosis. Then how the behavior of the patient too, like the patient will be restless and they may always be pacing about, or even hit their head out of like desperation or something. Like the patient will not be calm, like just not comfortable basically. And usually with cluster headaches, there's no nausea, there's usually no vomiting accompanied to it like migraine, and it's not also affected by light or sound, so no photosensitivity and all those other things. It's very important to distinguish like cluster headaches from other kind of headaches. So we're going to be looking at like the other kind of headaches and their distinguishing signs from cluster headaches. Like we mentioned earlier, for migraines, they have a longer duration, they are throbbing. Meanwhile, cluster headaches is like a stabbing pain. So migraine, longer duration, throbbing, comes with nausea, comes with visual disturbances like aura, like those other things, and it's usually not restricted to one side with and it's usually not strictly one-sided with autonomic symptoms. Then the also trigeminal neuralgia, which is like an electric shock facial pain triggered by touch or triggered by talking. Then we also have sinusitis. So here there will be a dull pressure pain with nasal congestions often on both sides. Then there's also temporal arteritis, which is seen in older patients, and here there will be visual changes, scalp tenderness. Then there's also glaucoma. So glaucoma is when there's high intraocular pressure in the eye, and it usually comes with like eye pain, blood vision. So all these other things can mirror like some symptoms in cluster headache. So it's good to distinguish like them from it's good to distinguish like the different symptoms, so you know like what exactly is wrong with the patient. So looking at the diagnosis of cluster headache, so diagnosis is based on clinical history and pattern. So there's usually no specific test, like the same way there's no specific test for tension type headaches. So the patient may need an MRI or CT scan to rule out other brain lesions or aneurysms if the headache is like comes on suddenly, or if the headache is usually unusual. So looking at the treatments, for acute attacks we can give medication like sumatriptan. So sumatriptan is given also in migraine. So for acute attacks, like for fast treatment, we can give sumatriptan by subcutaneous injection, and sumatriptan has like a rapid onset, and it is the best option in acute cases, because oral tablets are usually too slow, so it's better to give subcutaneous injection in this case. Then we can also use zomitriptan, which is an alternative to the subcutaneous injection, and is usually given intranasal, like through the nose, and it usually works faster than giving it orally. Then we could also give, like, for we could also give lidocaine nasal spray. So it's sometimes used, but it's not always effective. And the first line that is given in this case of in this case of cluster headaches, we give oxygen, like through inhalation, and is usually given first line and is highly effective. We'll give it for like 15 to 20 minutes before we start giving the other medications like sumatriptan. So looking at so for oral painkillers like paracetamol or NSAIDs that we can give for tension type headaches, or we can give for migraines, they don't work well for cluster headaches, because cluster headaches is a more severe form, and it does not respond well given just, in fact, oral medication does not help in this situation. So it's best to give the triptans. And for preventive treatment, like during cluster periods, to reduce the frequency and the severity of the attack, so we have some medications we can give there. So we can give verapamil. So verapamil is usually a first line preventive for cluster headaches, and we usually, when we're giving it, we start with low doses and we increase it slowly, and it usually requires ECG monitoring due to risk of like causing heart block or AV block. So we could also give prednisolone. So corticosteroids, they are usually used short term for like for rapid suppression, and then in chronic cases we can give lithium, and also as alternatives we can give sodium valproate, so as alternative preventive medications. So for the management, generally it's better to avoid the known triggers. So if you know that, okay, when you take alcohol you start having this kind of headaches, just avoid it. Even if sometimes people that take something frequently, it's harder for them to stop, but you have to look at like the long-term implications of what you are doing. So avoiding known triggers, having a consistent sleep pattern. So irregular sleep may trigger attacks, so having a regular sleep pattern, smoking cessation, there's something called the headache diary, so having it to help identify like the patterns and the patterns of the headache. So if, like, for example, if you have a headache diary, you would actually know yourself that, okay, this headache comes at a certain time in the day. So you actually know how to pinpoint which kind of headache you are having, or like you actually know how to tell based on like the different symptoms, like we discussed for like migraines, tension type headaches, for this cluster headache. So it's good to have this kind of like diary to know what are your symptoms, when they are occurring, and also like how you are responding to your treatments. Because when you are giving a medication for like something that is a condition that you're going, you have to also like be giving feedback, like how the treatment is working, if it's working for you. So all those kind of things, it's good to have like a diary for them. And then basically for the prognosis in this cluster headaches, they can these cluster headaches, they can last for weeks to months, followed by remission for like months to years. So the condition often reoccurs, but it is not usually life-threatening, and chronic cases can be more disabling, but they are usually also manageable with the right therapy. So that is basically the breakdown of this condition known as cluster headaches. It's usually more severe and more serious than the regular headaches that we have every day, and it's usually rare, so it's not something that is very common. So I just decided to shed light onto this kind of headaches, and I hope you enjoyed this video. So I'll see you in the next video. Bye.